social media. It's not a so often critically appraised domain. So we have Sakshi who will be presenting the critical appraisal of a YouTube video. I'll hand over to Sakshi.
Good morning, everyone. Like Sir mentioned, I think in today's age and world, since social media came into play from 2004, there's a lot of flooding of online sources of health information, be it through YouTube, through Instagram, through Reels, through Shorts, through TikTok. There are multiple areas where you get health information, which is targeted both for clinicians and for patients as well. Now, why we need to know this very clearly is because most of our patients do use social media and they get healthcare information from there, and therefore whether they're getting the correct information or not is something that depends on us to verify. So,
just touch the screen or something. That's okay.
Just not change it. Not change it.
coming to the background of the presentation, we have multiple websites which are providing us with healthcare information. While it's a boon because it helps us disseminate proper information to the lay public, to raise awareness about multiple issues, get them access to correct information which they may not have otherwise. This mass information awareness programs can help improve healthcare outcomes, can improve their self-management because they'll be more knowledgeable about diseases. It will improve decision making also with the doctors. However, there are multiple cons to this. If the information that is there out there is misleading, if it's not concise, if it's not relevant, if it's not credible, you can have harmful information circulating which can lead to bad information among the lay public. It can cause self-medication which may be harmful for them. It can cause non-adherence to medications, thinking that the medicines that doctors are giving may not be beneficial to them. Then, which in turn can increase the disease burden, it can increase resource wastage, and therefore can potentially lead to increased healthcare burden over the government itself. So, why do we need to critically appraise these media that's available online? So, according to multiple surveys that were done before this, up to 80% of Americans globally use internet to access healthcare information. When coming to India, among 900 million internet users, again around 59 to 60% go to internet to find healthcare information. When it, based on these healthcare information, according to a study done in North India, up to 55% of patients self-medicate, which can again lead to side effects, adverse events, harm to them. And about 44% think that the information that they get through internet is actually reliable information. In Tamil Nadu, when a similar survey was conducted, it was found that 60% of online users who get healthcare information do not validate the information that they get with their healthcare providers. Therefore, it may cause, again, harm to them, cause misinformation, which may be again spread and therefore lead to increased burden. So, why as physicians, we need to know how to appraise online media. I'm sure all of us get a lot of YouTube forwards, WhatsApp forwards asking whether this information is correct, whether they can use the information that's on the videos. Families calling us, so we need to know whether what they are getting is correct or not. Again, patients come asking multiple questions saying, I've seen this video, can I use it? So we need to be able to know whether the information that's provided through these videos are correct. So this was published in BMJ in February 2022, where the article provides its framework to assess how to appraise the videos that's currently up on social media. This is part 1 of the article. Part 2 is to help us assess the articles that are published based on the data that they've gotten through social media. So I'll be going through part 1 today and we'll do part 2 the next time. So why was this framework actually required? Before this, there have been multiple frameworks or criteria that have been information about healthcare and various sites. It may not be acclaimed sites, it may be various sites that come up that assesses written information, but there was no framework before this to assess published as a video or an audio file to assess them. Therefore, the need for this framework was felt. Now, how would they derive this framework is based on 4 criteria that were validated before this. There was the discern criteria. So this discern criteria had 3 things that they looked at, whether it was basically for treatment guidelines that were published, and it depended on the relevancy, on the bias, and the treatment options and effects that were in place, published through that article. JAMA Benchmark Network was published in 1999, and it dealt with multiple other domains like authorship, how credible was the authorship of the published information, what was the attribution given to various healthcare treatment options that were available, whether any disclosure was done of conflict of interest, and if the authors were getting any financial advantage by publishing those articles was something that was looked at. Similarly, LIDA was something that came up during the COVID time when there were multiple articles getting published in span of 2 years. You looked at whether there was good accessibility, usability, and reliability of those information. Now, these were all for assessing the written information that was available. Combining these 3, there was something called as Health on the Net Code of Conduct that came up. This was mostly a guideline for people to publish articles online. So it said whatever you needed to have a good credible information published online, which again used multiple things like authorship, attribution, justifiability of the publication, whether privacy was maintained, whether it complemented the current article that was, the current literature that was there. So based on these 4 derivations, they have come up with a 4-step approach, or 4 questions, 4 domains that you need to look at to appraise an article online or a YouTube video. So the 4 things that were there was trustworthiness, accessibility, usability, privacy, and confidentiality. Actually, it's very intuitive when you think about it, because most of these are very common sense questions that you would ask if you look at a YouTube video. So coming to case scenario, and then I'll go through all the 4 domains. So as a doctor in the ward, you have multiple patients currently admitted with dengue fever with low platelet counts. And all of them have seen different videos talking about use of papaya leaf extracts to increase platelet counts. Some of them encouraging the use, while the other videos are discouraging the use of papaya leaf extracts. So your patients have asked you whether they can use it based on these videos, and you want to review a couple of videos to tell them whether the videos that they have watched is actually reliable or not, and how do you give your correct assessment. So we'll be reviewing 2 videos today. I'll be playing both of them. I've reviewed the first one to show you how to review a video, and the second one we'll review here to ensure that we know how to do it. So I'll be playing the first one.
another episode of the liver dog. So if you have not noticed, there is a particular season where particular companies making a particular product has actually a lot of business that happens. And that season is the dengue fever season. So during dengue fever, we can actually see that a lot of company products, proprietary company products, which include papaya leaf extracts, are sold like hotcakes. A lot of people just buy papaya leaf extract capsules or make themselves at home papaya leaf extracts and take it for dengue fever to increase their platelet count. And this is rampant in India, and I think everybody just does it without even asking a doctor if this is actually helpful. And I think even a lot of doctors also prescribe, not just Ayurvedics or other traditional healers, but even non-medical doctors do prescribe papaya leaf extract or your Ayurvedic company made papaya leaf extract capsules to increase platelet count in dengue. So does papaya leaf extract really help increase platelet count? Yeah. So thrombocytes are the platelets, and when the levels go down, it's not thrombocytopenia. And dengue fever is one of the commonest causes for acute thrombocytopenia. That is, the platelet count reduces very fast and within a short period of time. And a lot of people actually give their experiences saying that when they take papaya leaf extracts or made at home, or even the capsules and tablets that are available in the market, when they consume it, their platelets have gone up. And a lot of testimonials, a lot of anecdotes, a lot of personal experiences are all over the place. Even studies. So when you look at the studies that actually talk about papaya leaf extract use in patients with dengue fever and low platelet, we can actually see that some of these studies have some post results where their platelets have actually increased because of the use of papaya leaf extracts. But are these really true? I mean, are these studies done in a very well controlled manner and properly look at how papaya leaf extracts actually increase platelet? For that, we actually have to know the causes for low platelet count. So low platelet count can be due to infections like dengue fever or malaria. Low platelet count can even be due to liver disease. So if a patient has chronic liver disease or cirrhosis, it can actually have very low platelet count, which actually persists for a very long time, as long as the disease persists. And the reason for low platelet count in other people may be something known as immune-mediated thrombocytopenia. That is, when your immune cells attack the platelets, destroy them, and your platelet counts go down. So the reasons for low platelet count is large, a lot of reasons, including cancers. And cancers can also present with low platelet counts, some blood cancers, also some cancer therapy. For example, some chemotherapy that we give the patients can also lead to low platelet counts. So low platelet count reasons are multiple. So when you target the reason, your platelet count will actually increase. So for example, in immune thrombocytopenia, when you give steroids or immunosuppression, then your platelet count will increase. That's the treatment choice. In liver cirrhosis, when you treat something known as portal hypertension, that is very high liver pressure due to shrinking of the liver, then the portal hypertension goes down. If the liver pressure goes down, you can actually see an increase in platelet count. Or in some situations, patients with liver disease will have large spleen. The spleen is an organ that is situated on the left side of the body. So when the spleen size increases, you can actually have a reduced platelet count because the platelets are taken up by the spleen organ and destroyed. So when you reduce the size of the spleen to various methods, for example, there are conventional methods, there are surgical methods. The spleen function reduces, the spleen activity reduces, your platelets getting work. So every aspect of low platelet, you don't actually directly treat the low platelet, you actually treat the cause for low platelet. So similarly, in dengue fever, you have low platelet count. And what is the reason? It is mostly because of multiple reasons, it's not just a single reason. So for example, in dengue fever, one of the theories is that when there is an immune attack, because of the virus in the body, there is an immune attack, there is an immune problem happening inside the body, and that immune problem leads to destruction of platelets, there is immune-mediated platelet destruction. You can actually have direct attack by the virus in the body that leads to bone marrow depression, or suppression, that is, the activity in the bone marrow. Bone marrow is where all the cells are formed, including the platelets. So when the bone marrow gets suppressed because of the infection or severe infection, the platelet production will decrease. Some of these patients that have severe dehydration, some have capillary permeability, that is, just small vessels start leaking out fluid, and because of that, they can have platelet destruction and low platelet count. So a lot of factors actually contribute to low platelet in dengue. So how do you actually treat low platelet in dengue? You actually treat the dengue fever. Right, so you give best supportive care in dengue fever, and the platelet count will reduce as the infection comes down. So for this, one has to understand what is natural history of disease. So whenever a disease actually starts, it progresses in some form, and then it comes down and becomes normal, or it progresses. There are chronic diseases that keeps going on in a long natural history. For example, chronic liver disease will be a long natural history, although goes up to the lifetime of the patient. And in dengue fever, what happens is that you have initially severe fever, vomiting, nausea, you have severe body aches, some of the skin rash. All this happens in the first 3 to 4 days, and during that time the fever will start coming down. So on the 3rd and 4th day, which when your platelets start dropping. And then look at these patients. Once you do supportive care, and once the platelets are heavily reduced during the 4th, 5th, and 6th days, by the 7th and 8th day, automatically they start rising because your infection is coming down. So this is a natural state in dengue. So the dengue fever comes up, fever goes, platelets start going down, and by the 6th and 7th day, once the infection is slowly coming down, the platelets start rising, and it automatically happens. That is what happens in dengue fever. It's a natural state. So what happens? Now if you look at the people who have been consuming papaya leaf extracts, they have been actually consuming the papaya leaf extracts once their platelets actually goes down. So when they say that on the 3rd and 4th day, the platelets are going down, they start taking these papaya extracts and papaya leaf pills or capsules. And they take it for the 3rd, 4th, 5th, and 6th day. And on the 7th day, they will see that their platelets are rising. So before we talk, the papaya leaf extract, the platelets are supposed to rise on the 7th and 8th day. This happens. Right. So it is actually a wrong, it's a bias. It's something like, it's not a post hoc fallacy. That is because you did a particular thing and something happened. You feel that this happened because of the particular thing that you did. It's actually a wrong thing, a wrong understanding of how disease processes work. So imagine that you give papyric extracts from the first day of fever, and then you see that on the fourth day of fever, the platelets are not coming down at all. That means papyric extracts are useful. Now go back and look at all the studies that have been done on papyric extracts. You can get in fever. You can actually see that most of these studies have actually given the papyric extracts and the papyric capsules when the platelets are dropping. So when the platelets are dropping, they start papyric extracts. And by the time the platelets are supposed to climb up on its own normally, and you become again papyric extracts, they feel that it's because of the papyric extract that the platelets have risen. So this is a wrong conclusion. And most of the studies are actually done that. That is why they are poor methods. But there are randomized control trials, if you want that I study, papyric extract use. So when you look at the latest analysis of all these randomized control trials, this is not a meta-analysis. This is from Sri Lanka, a group from Sri Lanka. They have looked at all the major studies done on papyric extract in dengue fever, and they have found out that even though some of the studies are of fine quality, most of the studies lack methodology. Some of them are very low number of patients included. Some of them are actually given papyric extracts just before the proper platelets. Some have given papyric extracts just after the platelets have come down. So a lot of methodological problems because of which they could not actually identify a good outcome of papyric extract. But when you look at all the studies together, they identified that papyric extracts did not actually improve platelet counts the way they wanted it to. And this is an analysis data that has been published in 2019. So I will link all of these studies below this video so that you can actually take a look and see the conclusion in actually concluding that papyric extract is actually recommended for low platelet count in dengue fever. It is not recommended. You look at any infectious diseases society in the world, Europe, US, India, anywhere you look, papyric extracts does not feature in the guidelines for treatment of dengue fever. It's very simple. Dengue fever is such a deadly disease. It's all over the world. It's endemic in a lot of parts and it kills a lot of people. And the low platelet count and breaking it is one of the. And when you look at all the studies, together, we found out that there is no conclusive evidence to show that the papyric extract does not work in dengue fever. And it is not recommended by any clinical society, any infectious diseases clinical society in the world for dengue fever. This is a fact. Now people will come and comment under this video about how papyric extract saved them, they will show you. But now know that as a personal experience and doesn't mean anything, it has no value for scientific method, and no value in recommending such for our patients in dengue fever. So dengue fever needs best supportive care. And because of supportive care, it is difficult to manage this disease. And along with the supportive care, if you are going to give Carica papaya, it is not because of Carica papaya extract that things are getting for it is because of the supportive care. So please realize this fact and know that low platelet count due to multiple causes cannot be targeted or improved by Carica papaya extracts. I would also like to point out the fact that there are mechanisms by which platelet counts actually increase. So if you give a medicine or an extract, you have to say that because of this particular action in the body, the effect has happened. So that particular kind of mechanism of action of Carica papaya is still not understood. Just imagine. So if you look at a painkiller or an antibiotic, you can say that the antibiotic actually kills the bacteria because it acts on the cell wall of the bacteria or inside the bacterial inside the microbe. It destroys the DNA, it destroys some part of the bacterial organelle. And there is a bacteria dies because of that particular antibiotic. So we have mechanisms of action that we know. So second mechanism of action of increasing platelets in dengue fever because of Carica papaya is not yet understood. There are a lot of theories going around saying that there is an enzyme called lipoxygenase enzyme which increases platelet specific lipoxygenase enzyme which is increased in the use of Carica papaya and because of which platelets are increasing. These are all hypotheses. People have proposed this, but nobody has actually identified this in humans or in small animals or in the major tissue based studies. A lot of work of Carica papaya at the molecular level happens in cells and tissues and in small animals, and the good amount of work that we see in the humans are actually low method and low quality, which also we have no conclusions on it. So I think in future maybe we will identify some chemical or something from the papyric extract that actually can increase platelet count, we don't know. But until then we have to wait. And until then, please remember, papyric extract very bitter. You can actually take it. So it's not palatable. Don't torture yourself on that. Instead, have some papaya salad. It is actually good. You can have some good papaya salad. You can have papaya. It's a good laxative. It will relieve your constipation and things like that. So use papaya, but it's actually good for use. And just leave the leaves and stems and barks and all because that don't work out. And I hope this video was useful to you. And I'm going to put up all the links for you to check based on what I have been talking here. And
coming back to a presentation, we all saw the video. So let us appraise it and see if the video was actually up to the mark or not. So there's the four-step approach for people who join us later. Basically we are trying to look at how to appraise the social media health information, either video or audio, and there's a four-step approach to do that. So the first one is trustworthiness. It's basically actually the most important of all the 4 domains, because we want to know how credible, how relevant the authorship of the video is. So if someone has the expertise to comment on the given topic that they are talking about, if they have credentials that will actually let us believe them as to what they are saying. Second thing is content comprehensiveness. So if they are talking about some disease, whether they are talking about all aspects of the disease, whether it's up-to-date information or not. So if they are talking about, let's say, dengue, whether they are talking about the epidemiology of dengue, whether they are talking about how it's transmitted, how it can be prevented, what are the current treatment options available, all of that is something that you need to have in a video to say it's comprehensive. If they're talking about some treatment options, what are the indications for the treatment, what are the risks, what are the benefits, how do you administer that treatment, what is the clinical evidence currently available to support the use of that treatment is something that you look at. When you look at whether it's balanced views or not, and whether they have addressed areas of uncertainty. So let's say they are talking about a particular treatment, if it's completely certain that this is the evidence that will work, or whether there are some uncertainty, say it's not being tested in certain groups, or whether they are giving balanced views. Someone who is giving just one-sided view, you may take it with a pinch of salt, saying okay, they are not weighing both sides of the coin. Then lastly is whether there is any conflict of interest of the author who is presenting the video. So coming to the source of content and whether qualifications of the author transparently reported. So ideally at the beginning of the video, the person who is reporting it should tell their credentials, should tell their name, and should tell how they are related to the topic. So for example, if someone is talking about dengue, ideally you would want someone who is an infection specialist or some physician who treats dengue on a daily basis. In this video, the person who is doing the video has actually not mentioned his credentials at all in the beginning. However, if you look at his bio on the YouTube platform, he gives it completely saying his name, what is his credentials, he's an MD medicine and he's done a DM in hepatology, what hospital he's affiliated to, all of that is mentioned in his bio. However, ideally it should be mentioned in the video itself. Now, why is it important to look at the authorship? So let me give you an example. Let's say there are 3 videos on use of cannabis in medical circumstances. So one is reported by a physician who's working in addiction, and second one is reported by a health news reporter, and third one is reported by any influencer on Instagram. Who would you more likely to be able to believe? Whose content would you be more likely to be able to believe? So that's obviously a person whose credentials affiliate to the given topic, who has expertise in that topic. That's why authorship is very important. So what is the qualification of the author, how is his affiliation, and where he got the content from. So whether the source of content is clearly mentioned or not. So if some YouTube channel person is talking about some intervention but did not mention as to where they are getting that information from, it's not clear, it's not, whereas in this video he's actually linked all the contents, all the studies where he's derived his content from. So that's how actually you should be reporting with all the contents clarified. Coming to the next question, does the author actually present a comprehensive and up-to-date assessment of the topic? So like I mentioned, if it's talking about a particular disease, all the aspects of the disease. If it's talking about treatment, all the aspects of the treatment need to be mentioned. So in this video that we saw, he's mentioned about up-to-date literature. This was published in 2022. So he's mentioned till 2019 all the up-to-date literature that was there. He's mentioned all the treatment options that are available in terms of supportive care. In a segment of the video, he mentions about hemorrhagic dengue fever and platelet transfusion as indicated. He's mentioned about natural history and how some of the symptoms appear. However, he's not mentioned about how dengue gets transmitted, how you can prevent getting the dengue, or what are the risks of the treatment that is being refuted here. So he's not mentioned any risks of what excessive papaya leaf extract can cause. Now coming to our areas of uncertainty presented, or is there any balanced presentation of view? So why is this important? Like let's say there's a pharmacological company who is putting out a video on the use of their drug in a certain medication. Like for example, let's say vagus nerve stimulation and use of migraine headache. So if it's a medical device company who's putting out the video saying our device actually helps in reducing migraine headaches, but they're not mentioning any side effects, they're not mentioning whether it's actually proven or not, whether how much is the efficacy, or whether there are other treatments, whether there are other side effects of it, then it's not a balanced view of presentation. Okay, and they don't present any uncertainties, that also is not adequate. So any areas of uncertainty given a treatment option should be explored in the video. If there are any contradictory views, that also should be mentioned in the video. So here he's mentioned in a segment of the video that the studies that he's talking about has not included severe dengue cases. They've not included hemorrhagic shocks. He's mentioned that the methodology was not great. And he's also mentioned that there needs to be further work on these molecules at a human level at earlier onset of disease to see if it actually works or not. So it looks like there is a balanced view that he's presenting. Now coming to whether the content is independent of conflicts of interest. So there are two things that you look at here. One is whether the content is linking to another thing that he may be advertising. For example, like I was talking about the medical device company, if they are linking their own device in the content, that means it's obviously not free of conflicts. They want you to click on the link, they want you to look at their devices that they are selling. So that includes conflict of interest, which again decreases the credibility of the video. So that's something that we need to look at, whether the content. So for example, if this guy was talking about in favor of papaya leaf extracts, but he is part of the company that manufactures papaya leaf extract pills, then it would have been conflict of interest, which is something that you need to look at about the authorship of the video. So coming to the next domain, which is accessibility. So when you look at accessibility, most of these videos are made for public health information. Therefore, accessibility plays a very important role as to how effective they will be in transmission of the information. So you want to look at whether there is any access restrictions to the video, whether there is any need for technical expertise to access those videos, and if they have linked the contents, the source of the contents of the video or not. So is there any content access restriction in this video? It's on YouTube, which is freely available. So there's no money that gets charged to it. There's no access restrictions at all. And like he's mentioned, the sources of the content or the papers that he's mentioned, those are also on free access. They are not gatekept. So that way it helps to increase accessibility of the YouTube video itself and the content sources as well. Compared to this, let's say if you have a video which is posted only in a Facebook channel and is accessible only for the members of those channels, or there's a website that you need to access the video on, but you have to log into that website, you have to become a member of that website, that decreases the accessibility of the video. So can the user obtain content from the platform without any technical expertise? Yes, you don't need much technical expertise to access any YouTube videos. Coming to usability, if there's if it's easy to use for whoever is getting targeted to, if the language that is used is simple or not in the video, and if there are actionable items that's mentioned, that's how the video can actually help them in the future, is something that you need to look at. So coming to the easeability of use, if ideally the video should mention what audience they are targeting. If they are targeting clinicians, if they are targeting scientists, if they are targeting lay public. However, this video is actually not mentioned, but it looks like it may be catering to both clinicians and lay public. Now, so if you have something that is targeting only to the public, the standard is to use language such that someone who is educated up to 6th standard can understand the video. So if it's any more complicated than that, then the usability of the video decreases. In this video, language seemed mostly simple, but he's used multiple medical terms, which he then goes on to explain as well. But still, I would not say it's so easy for us up to 6th grade standard person to understand. Then if it's targeted toward clinicians, you should have a video that does not talk in too much scientific jargon, too much statistical analysis should not be mentioned. It should be simple for for all graduates to actually understand. So you should not have any technical terms in the video. Like for example, in this video he used something called as post hoc fallacy. So that may not be understandable to all graduates, all clinicians. So I think that's something again that you have to keep in mind when you are interpreting or analyzing the videos. Then last is, this is again one of the important things that you have to look at is whether the content have the potential to improve patient care by providing actionable items and whether they support the patient-physician relationship. So give me an example. Let's say there's a YouTube channel content creator who's put out a video saying there are a lot of side effects of epidural anesthesia and doctors don't tell you the complications and therefore you should not go for that. That is not actually promoting patient-physician relationship. So such videos have been able to have bad content or the usability decreases. On the other hand, if you have a video that is targeted towards clinicians saying, you know, if patient comes with a cardiovascular disease, you can tell them to stop smoking, to change their lifestyle. All of that are actionable items that someone can take from the video and practice in real life. And that will also promote patient-physician relationship. So those are two things that you have to look at when you are looking at what the video is leaving you with as things that you can do after watching the video. So here the content creator is actually advising aggressive hydration, they are advising supportive treatment, they are advising taking papaya salad for whatever its benefit is, but they are not looking at anything that increases or improves patient-physician relationship. So that is something that also needs to be mentioned in the video. Now coming to the last thing, privacy and confidentiality, it's one of those most important things that any online social media platform needs to look at as to whether they are taking any of your confidential data while accessing the video. If they are asking you even some simple questionnaire about your age, sex, what you do in life, can give multiple information that the user may not be okay to give. If they are using such information, they should mention how they will use these confidential data, how are they going to store it, how are they going to disseminate. If they are giving the information to any third-party user to analyze that data, or if they are having any other cookies that they are using while you access the website that may actually leak or will be a breach of your privacy and confidentiality. So that's something again that you have to look at while appraising these videos. So based on these four things, we'll just divide the group into four. So I'll play another YouTube video and we'll appraise that video. So maybe 3 of you here can do trustworthiness, next 3 on accessibility, next 3 on usability, and you guys can do on privacy and confidentiality.
Low platelet count is a very common problem these days, especially if you have ever suffered with dengue or chikungunya. You know what I mean, right? Doctors always become concerned about your platelet count, how much platelet you want. Round about 1.5 lakh to 4.5 lakh platelets per microliter is what you should be having. If you are having something lower than 1.5 lakh, then the situation is considered as low platelet count. Now, how you can fix it? Is there any natural way? Yes. In this video, we are going to discuss about how naturally using the normal Indian food you can boost your platelet counts. So without wasting any time, let's get started. Hello everyone, welcome to Wellness Smart. So in this video, we are going to discuss about 7 harmful Indian food which can help you to boost your platelet count naturally. First thing is papaya leaf extract. I'm sure you have heard about it, but you must know how to have it, how much to have it, and when to have it. Then only it will give you the effect that you are actually looking for. Pluck 1 or 2 papaya leaves, wash them thoroughly, and then grind it, extract that juice. Let me tell you, the juice is going to be bitter. Up that juice like around about 25 to 30 ml. If you're an adult, if you are a kid, then it should be between 5 to 10 ml. Try to have papaya leaf extract every day in the empty stomach in the morning or in between 2 meals. If your platelet count is really very low, then consider having it 2 to 3 times a day. You have to continue doing it for at least a month or at least 15 to 20 days to see any difference. The next one is guava leaf extract, just like papaya leaf.
So we'll go back to the thing. I just wanted to focus on the papaya leaf since that's what we are dealing with. Okay, so the first clip, you want to talk about trustworthiness of the, I will,
She's mentioned she's a nutritionist.
okay, I'll give you her credentials. This is what she's written, is the credentials and the source of her video.
Working in the field of diet, food and nutrition is quite vague. Like where exactly is she working? Apart from PhD, what else? Like, nothing much is clearly mentioned.
She may not be qualified for describing why a patient would have no platelets or probably prescribe different treatment aspects. Other thing is conflict of interest. She's telling people to go to her site. Probably there's ads on that site where she's getting money. That would be the other way around.
What do you think about content comprehensiveness?
So far, she has not mentioned any. She's talking about dengue, chikungunya, but what is the natural disease progression? All that she has not mentioned. She just gone straight to advising papaya.
Yeah, she's not mentioned about how papaya leaf may actually work. She's not mentioned about what are the implications of taking it. She's not mentioned about risk of the same. So actually the content comprehensiveness is very poor. Even the source of where she's getting evidence is again linking to her own website. It's not scientific journals that she's attempting to say that these things work. And there's no balance view. She's not telling what are the uncertainties, whether it may work, what conditions it may work in. So all of it actually seems very vague. Coming to accessibility. So what do you think about these things? Is there any access restriction when you access the video? No, it's on YouTube, it's freely available, you don't have to become a member, you don't have to log in, anyone can see. You don't need any technical expertise. What about links to source of contents? Correct. So if you see, there is a link in the for evidence consider reading this blog. But again, that blog refers to her own company. So it may not be a very good source of the thing. And although it's open, again you have like Nivil mentioned, there are a lot of ads on that thing. You have to give some information to become a member. So that is next, usability. So what audience do you think it's targeting? Sorry? She's promoting her institute, but when you look at usability, you're looking at the ease of use. You're not looking at any conflict of interest. When she's promoting her own channel, that's conflict of interest. Usability is whether you can use it easily. So it looks like it's getting targeted to lay public only, and it's in simple language. So anyone who understands the language will understand. So the ease of use is there. She's not used any significant technical language. She said thrombocytopenia, but she explains what it means. So it's easy to use. However, the last point is actionable. Do you think it's any actionable, or does it promote any patient-physician relationship? No, it does not. She's telling you how to take the papaya leaf extracts, but nothing very actionable about it, and she's not talking at all about contacting your physician to know further evidence of the same. What about privacy and confidentiality?
She didn't ask for it.
Yeah, so it's on YouTube. There's no need for your personal information, so it doesn't reach any privacy and confidentiality. So overall, the impact of this YouTube video will be much lower, and the evidence or the credibility of this video will be much lower than the previous video that we've seen.
Actually, in the first video, how would you endorse patient-physician relationship? Because he's saying that certain physicians do give papaya.
Yeah. So the things that you can say is, one is contact your physician. Discuss with them what you want to do. Whether if you think you may want to take papaya leaf extracts, ask their opinion. Along with that, because there's no evidence, make sure that you get your supportive treatment, that you get hydration well. So that way you can say that, look at it positively and talk to your physician properly and say that you have seen these videos and it doesn't show benefit, should I talk? So you don't, The way he was saying is putting down some doctors which should not be there. You should actually endorse that relationship and say, okay, go.
If he says, if someone asks you to take it, go for a second opinion, is that also contradictory to patient-physician relationship?
And it may be. Okay, so I think just talking about how to endorse, I mean talking about that shared decision making here will be more important there. So these are your views, talk to your doctor and see what his views are, and then see what you want to do based on the evidence that's there.
More about not saying this is the gospel truth. I'm saying something on the net for your information, and also contact your doctor before you make this. Just a shared decision.
So this was how I had interpreted the same video and similar to this what we discussed. So coming back to your scenario, when patients come with such videos or when they have these videos and these doubts, one thing is you should always inform them that all YouTube videos or all content creators may not give you reliable information, and therefore looking at where the information is coming from, who it's coming from is very important. Second is you can give them videos that you think are actually reliable, that provide correct information, and tell them to look at those videos. So there are multiple videos by CDC, by IDSA, by NEGM, or written materials by UpToDate for patient source information that you can give them, saying, okay, these are more reliable than what you are looking at, and maybe you can look at these and make information. And last is, while assessing the patient's values, because you cannot, especially when there's no evidence on certain things or there's contradictory evidence on certain things, you have to take the patient's value, patient's perception and his interest in consideration, and while talking to them, make a shared decision making, saying, okay, this is the current evidence, this is what we are looking at, what do you want to do, this is my opinion. So based on that, you can make a shared decision making and go about how to do further steps.
Thank you, Sakshi. So, very well done. Any questions from the audience or any questions from the online audience? Seem to be none. Sir, any thoughts?
No, I think it's increasingly important because these are the things that patients increasingly are all on smartphones. You will find a driver or attenders on smartphone, and they believe that than what you tell them. I heard on net because I share something with you, then it's like their friend shares, this is very good, and they change their practice often. So we need to this kind of talk. We should give in many places. The patients also should, like we are teaching ourselves, like preaching to the crowd. So we should preach to this. Somehow we should get this kind of this YouTube video of teaching how to interpret a YouTube video. We should get patients also to. So we should see like, later on if we edit it, whether we can play like in many hospitals if you go, and there's nothing to do with the talk. I'm saying they'll have a diabetic opinion in the patient waiting area that we have video going on diet and exercise and medication and all. Maybe like in our OPD waiting area we can play this video like how to interpret you're watching YouTube. But it make it little more patient focused like so that hey, do you ever wonder like whether this YouTube video is reliable or not? And then take them through this. It may be a useful thing. But they did an excellent job. Mostly also did last time. Good show. Well done. Let's give one now. Well done. Is there any online question?
No questions online.
Okay. Which one?